Assalamu alaikum dear students. Today we will be studying the mandible. We will be studying the gross and bony features of the adult mandible, the attachment of muscles on the mandible, and the attachments of various ligaments on the mandible and the joints formed by the mandible. The mandible is the bone of the lower jaw. It is the largest, strongest and lowest bone of the face. It bears the lower teeth. The mandible has three parts. It has a U-shaped, horizontally oriented body and two vertically oriented rami. First we will study the body. The body has two surfaces, the internal surface and the external surface. This is the external surface and this is the internal surface. We will be referring to these diagrams, so please remember this is the external surface and this is the internal surface. The external surface, and now the two borders, the superior border, which is also called the alveolar border, and the inferior border, which is also called the base of the mandible. On the inner side of the base of the mandible here are two depressions called digastric fossae. These give attachment to the anterior belly of digastric muscle. Coming to the external surface, the external surface in the midline has a faint ridge which is called the symphysis mentae. It indicates the line of fusion of two halves of the mandible. The symphysis mentae expand in the lower part into a triangular elevation called the mental protuberance. Mentum means chin, so it is mental protuberance. It forms the point of the chin. Here, this area, it forms the point of the chin. This is the base of the triangle, and the base of the triangle is limited on either side by a tubercle called mental tubercle. One mental tubercle on this side and the other mental tubercle on this side. On the inner aspect of the symphysis mentae, there are four tubercles, two above and two below. They are called genial tubercles or mental spines. They are arranged in two pairs, the upper pair and the lower pair. The upper pair provides attachment to the genioglossus muscle and the lower pair provides attachment to the geniohyoid muscle. Just below the premolar teeth, there is a foramen called mental foramen. Mental nerves and vessels pass through this foramen. And this line is called the oblique line. The oblique line is the continuation of the anterior border of the ramus of the mandible, continues as oblique line in the body of the mandible and is continues towards the mental tubercle. Just below the incisor teeth, there is a shallow depression on either side of the symphysis mentae. This is called the incisive fossa. With this we finish the external surface of the body of the mandible. On the internal surface, this line is called the mylohyoid line. Below the mylohyoid line, in the posterior part, there is a groove called the mylohyoid groove, which lodges through which passes the mylohyoid nerve and vessels. Above the anterior half, above the anterior half of the mylohyoid line, there is a fossa which is called sublingual fossa. It lodges the sublingual gland. And below the posterior part of the mylohyoid line, there is a fossa which is called submandibular fossa, and it lodges the submandibular gland. This is the sublingual fossa. This is the mylohyoid line. This is above the anterior part of the mylohyoid line, the sublingual fossa, which lodges the sublingual gland. This is the mylohyoid line, and below the posterior part of the mylohyoid line is the submandibular fossa, which lodges the submandibular gland. And below the posterior part of the mylohyoid line, this is the mylohyoid groove, through which runs the mylohyoid nerves and vessels. Now we will discuss the attachment of muscles on the body of the mandible. This is the external surface of the body of the mandible, and this is the internal surface of the body of the mandible. From the external surface, just below the 3 molar teeth, arises the buccinator muscle, and from the lower border or the base of the mandible is inserted the platysma muscle. On the base of the mandible, in this area, is inserted the platysma muscle. This is the place of origin of depressor and labii inferioris, and just below it and posteriorly is the site of origin of depressor anguli oris. Coming to the internal surface, the mylohyoid muscle arises from the mylohyoid line. The just posterior to the symphysis mentae, from the base on the inner side, arises the interior belly of digastric muscle. The genioglossus muscle arises from the superior genial tubercle, and from the inferior genial tubercle arises the geniohyoid muscle. Above the posterior part of the mylohyoid line arises the superior constrictor muscle of the pharynx, and just in front of it, below the last molar teeth, arises the attached the pterygomandibular ligament. To this area is the pterygomandibular ligament attached. So this was the attachment of various muscles, ligaments on the external and internal surface of the body of the mandible. Now we will discuss the ramus of the mandible. The ramus of the mandible is somewhat quadrilateral vertical plate of bone. It has got 2 surfaces, the lateral surface, the medial surface, and 4 borders: the anterior border, the posterior border, the inferior border, and the superior border. And the superior border presents a notch called the mandibular notch. It has got 2 processes. One process that projects from the posterior superior part of the ramus of the mandible, that is the condylar process. The upper part of the condylar process is expanded and is called the head. It articulates with the mandibular fossa in the temporomandibular joint. Below the head is a constricted area called the neck, and on the anterior surface of the neck there is a shallow depression called the pterygoid fovea. The other process, called the coronoid process, is thin and triangular in shape. The lateral surface of the ramus of the mandible is flat and has oblique ridges. That is due to the attachment of the masseter muscle. The medial surface has a foramen just above the middle of the mandible. This ramus of the mandible, just above the middle of the ramus of the mandible, it has a foramen called the mandibular foramen. This mandibular foramen leads to the mandibular canal, which runs downward and forward, passes through the body of the mandible and comes out to the outside as the mental foramen. This transmit the following structures: the inferior alveolar nerve, which is a branch of the posterior division of the mandibular nerve; the inferior alveolar artery, which is a branch of the first part of the maxillary artery; and the inferior alveolar vein. On the anterior margin of the mandibular foramina, there is a tongue-like structure called lingula. This is lingula. From the lingula, from the lower side of the lingula, runs the mylohyoid groove. So we have finished the rami of the mandible also, and now we will study attachment of muscle on the ramus of the mandible. Now we will discuss the muscle attached to the ramus of the mandible. This is the lateral surface of the ramus of the mandible. This is the medial surface of the ramus of the mandible, and all muscles of mastication are inserted into the ramus of the mandible. The masseter, the temporalis, the lateral pterygoid, and the medial pterygoid, all these four muscles are inserted into the ramus of the mandible. The masseter muscle is inserted into the lateral surface of the ramus of the mandible. The temporalis muscle is inserted into the coronoid process, the anterior border, and some of the medial surface of the ramus of the mandible. The lateral pterygoid is inserted into the pterygoid fovea, and the medial pterygoid is inserted on the medial surface just close to the angle of the mandible. So these are the insertion of the muscles of mastication on the ramus of the mandible. Now we will discuss the ligament attached to the mandible. This ligament, the lateral ligament of the temporomandibular joint, are also called the temporomandibular ligament, is attached to the lateral aspect of the neck of the mandible, and at the angle of the mandible. The angle of the mandible is the place where the ramus of the mandible joins the body of the mandible. So at the angle of the mandible is attached the stylomandibular ligament, and just below the last molar tooth is attached the pterygomandibular ligament, and the sphenomandibular ligament is attached to the lingula. Lingula is present, a tongue-like projection we have studied, present on the anterior margin of the mandibular foramen. The mandibular foramen lead to the mandibular canal, which transmit the inferior alveolar nerve, inferior alveolar artery in an inferior alveolar vein, and this comes out. This canal opens at the mental foramen here. So these were the ligaments: the lateral ligament of the temporomandibular joint, also called the temporomandibular ligament, the stylomandibular ligament, and the sphenomandibular ligament, and the pterygomandibular ligament. These are the attachments on the mandible. The joint formed by the mandible with the temporal bone is called the temporomandibular joint. The superior articular surface is formed by the mandibular fossa and the articular eminence of the temporal bone, and the inferior articular surface is formed by the head of the mandible. So a joint is formed between the head of the mandible and the mandibular fossa and the articular eminence. The articular surfaces are covered by fibrocartilage, and this temporomandibular joint is a synovial joint of condyle variety. We will further discuss the temporomandibular joint in a separate lecture.